Hello, everyone. It's been quite a while. I haven't been on live streaming. It's been a while. Hello, good to see you. It's been a while. I haven't been on here. I just decided to pop on here for a little bit and answer some questions and give some information. So thank you. Thank you for joining in. I appreciate you. Thank you. How have you been? Hey Shay, how are you doing? Good to see you. Good to see you. If you would go ahead and just share out the live for me. I'm literally going to be here. I usually say that and then I'll be running for an hour. As you can see, I'm still in the office. Preparing a checklist for some of our clients. Thank you for joining. Hi, Amy or Amy. Good to see you. Good to see you. Thank you for coming on. I have not been on here in so long since I went. Thank you so much. I appreciate that. Thank you. Hi, Sadaphani. Thank you for joining. Good to see you. Good to see you. I'm gonna stop this music. How to do it. I think I conquered. Yes. Thank you all for coming in. It's so good to see everyone after being away for so long. I was away on a medical mission trip. I do that every year. Brett, Faith, thank you for coming in. Good to see you. Come on in, come on in. I want to talk about non-medical home care agency. There's some information I want to share about the state of New York specifically, and then answer some questions that you may have. As you're coming in, just say hello. Type in something in the chat so I know that you can also hear me. Who knows? I could be talking to myself. Having to learn how to navigate these things again. You know what a difference a week makes, or 2 weeks of being away. My assistant just said to me this evening, Dr. B, it's been so quiet since you went on the medical mission trip. And I came back with some respiratory issues and just really trying to recover. So as you come on in, share out the live for me, please. And then say hello in there. I'm so glad you're here. Cheers for coming in. This right now, if you look in the back, I can turn so you guys can see I'm still at work, still at the office. I think that was something the office might have celebrated my birthday since February, and that thing does not want to go away. It's still sitting there. Oh my. Hi, Simple. Thank you for liking the live. Thank you so much. So today we were getting ready to start the process of submitting an application for a non-medical home care agency for one of our clients. And it's been a while since we did something with New York. So I wanted to verify and clarify things because things have changed so much in the state of New York. since we last did an application. Even for non-medical home care agencies, they are requiring that you do the certificate of need, and that you go through it's a lot of hoops. You have to do a financial statement, you have to do, and what you don't know is that you can still submit all of these things, right? And still you don't get approved. Hi Nini, hi Zoshe, hi Simple. Thank you for liking the live. Thank you for coming in. Come on in, come on in. Nini, good to see you. It says you will lose your subscription benefits. Oh well. Lucy 2020, thank you for joining. It really has been a while. Simply, oh, I think it's Oluwin Jackson. Thank you for joining. And he said, hey, good to see you. Everyone's like, where is Dr. B? Where is she? Well, I went on a medical mission trip. Hi, Johnny Apps. And I do that every year around July. Hi, Alexander. Good to see you. Thank you for sharing out the live. I appreciate that. Good to see all of you. I feel like I've been away for so long. I started this foundation. It's called Blessings Heart Foundation. Thank you, Rave. I appreciate that. Blessings Heart Foundation, and I started it in 2020. We do a lot of work here that is concerning food. We do free food pantry in the state of Georgia, and then we do the free medical services abroad. So the free medical service, we've done it. This was my 7th clinic. So that's why you didn't see me for a while. Hey, come on in, come on in. Good to see everybody. As I came back, we have a lot of applications pending, lots of people waiting for their stuff to be submitted, for approval to come in. Hey, Shante! Thank you. And so I called the state of New York. Hi, Marlene. And the licensing office. And I said, well, I'm getting ready to submit an application for a non-medical home care agency. Do I still need to do a CON for a non-medical home care agency? Remember, the non-medical home care, hi Shante, the non-medical home care agency is one where you provide non-medical services, right? You're providing services like personal care, and you're providing companion. Thank you for the follow. And you're also providing homemaker services, right? In many states like Massachusetts, for example, you don't really need a license. Thank you for the follow. Hi, Mimi. Good to see you. But you do need to have your policy and procedures. You need to still get some things done if you want to become a Medicaid waiver provider. Hello. And so New York now says, nope. We don't care if it is non-medical. We don't care if it is a skilled home care agency. The skilled home care agency, it's called home health agency. That's the difference. With home health agency, you're providing skilled nursing. You're providing physical therapy. Mimi says, hello, everyone. Hello, Mimi. Good to... something in there. I appreciate when we're communicating. Hey y'all, I love for those of you who know me, who've been on my previous live, you know I love to make it interactive. I like for you to ask question and I answer the question and we talk. And if you don't know me, my name is Dr. B. B is for blessing. My doctorate is in is in healthcare management. I am a registered nurse. I have a degree as a family nurse practitioner. I've owned and operated a home care agency for the past decade. And it's been a successful one. Continuing, I'm in my office right now. And I also have the consulting agency where I help other people open their own home care agencies. And I help train them and coach them and help them succeed with their own agencies. I think one of the issues is always people pay someone to open for them. Thank you so much, Mimi. I appreciate that. So oftentimes people will pay people to open for them. And then once you get your license, you're lost. You are totally lost. Like, where do I start from? What do I do? And that's, hi, Joanna. See you. And many of the clients that I have are people who someone else may have opened for them, and then they just don't know how to start. How do I get clients? What am I supposed to do first and second, and so on and so forth? So what I do with my people is that once we open for you, I encourage everyone to join the Deluxe Success Club, where I hold their hands. We talk about it. We have our own designated WhatsApp group, which we really just started the WhatsApp group not too long ago. And we, every day I'm giving tips. I'm guiding you on how to market. We have exclusive, club meetings. We have one coming up this Saturday with the club members, where we talk about all the things that's going on with them. Mimi says that's where I am right now, and how to start, how to get client. All right. So Mimi, do you already have your license, and which state are you in? And I may have to bring you up so that, because the typing may be another thing. Thank you for the follow. Hi, Shante. Thank you. And this used to be a challenge for me, doing that thing. Gotten better. So many people come to me in that space where they have already gotten, hey, Yasmin. Mimi says, I don't have my license yet. I'm in Illinois. Okay, great. So that's the other group of people where we open. Hello, Dr.B. Hello, my Yasmin. I've missed you since I've been on my mission trip. So the other group of people are the people that do not have the license at all. Thank you, Yasmin. The other group of people are those who have not opened. They want to open. They don't know where to start. So we start with you from the beginning. We don't leave you after we get you the license. We follow you. We train you on the things that you need to know, because that's just someone said you help facilities set their rates. Pinadel, I don't understand. I don't do facilities. Let's start from there. A facility, you will be talking about like the group homes or the assisted living facility. If you want business coaching, because I do healthcare, if you want business coaching, that's a whole nother thing on helping you determine how you can set your rate, how you can charge people. But then also understand that if you are credentialed for insurance or Medicaid, you don't get to set the rate. They set the rate for you. They tell you how much you're going to get reimbursed for different clients. So that's a whole nother thing completely. But if you are needing the guidance on how to properly operate your business to where you know what charges that you're putting out there for people, and what kind of services you're offering, then you're in the right place too. I can help you with that. Aside from that, I don't help open a facility. I help open a non-medical home care agency. So like, I think Mimi was saying that she has not opened hers yet. That's what we do. And so this, afternoon, I was trying to, but we're getting paperwork put together to submit. And so New York was just bugging me. And I said, well, let me call New York and first of all, see what's going on. And they have put like, thank you, Yasmin. I know you were having so much trouble with that. Finally, welcome, Yasmin. Good to see you and good to have you in the group. I wonder how business is going. I've been away and I haven't been asking about you lately. If you can hear my voice, I came back with something. I'm trying to get over it. And I think it's Mimi, we do provide services for those in Illinois too. So if you want that, go ahead and subscribe and then click the link in my profile to schedule a one-on-one appointment with me. Mimi says, I'm in nursing school. I want to get it started before I'm done with school next May. Usually, I would tell my nursing school, I'm a professor of nursing, Mimi. I usually would tell my nursing students, hold on a little bit. Hey, purpose thing. I appreciate it. Thank you so much. I often would tell my nursing student, thank you, Yasmin. I appreciate that. Thank you, Rev. I would say, hold on a little bit and finish school. Why I say that is because, already nursing school is an elephant of its own. And, thank you, Rev. I appreciate is a lot. What I would recommend for you, Mimi, is if you want to be part of the Success Club, maybe just the TikTok Success Club, not the Deluxe Club, because the Deluxe Club is $199 a month. But start with the Success Club. Be available as I'm teaching, and we can start. Thank you for come to the team. We can start preparing you, but I wouldn't want to get you starting a business while you haven't finished and you haven't taken your NCLEX. We can just get the process started gently and you are learning the stuff while you focus on school, because you will need that nursing license as part of your business. It will make things so much better for you. Okay, I would not want to take your money and start you, because opening a business is like having a baby. You need to be able to give it your time. So pass that NCLEX, which I know you will pass. Just if you want to, again, subscribe. I do this teaching often. I usually do come up here like twice in a week or 3 times in a week, but I'm doing videos. If you look at my profile page, there's a lot of things you want to learn and get a lot of things under your belt, because one of the things that causes people frustration in this business, and some people quit quickly, is not knowing, not understanding how the business work. A lot of people think you just open this non-medical home care agency, and then some people will say get into Medicaid and they'll send you clients. It doesn't work that way. They just don't send you clients. You work for those clients. You build those relationships to where your name gets into a place where they can call you, they can reach out to you. So I teach you how to develop and build those relationships. I teach you how to go out into your community and build those relationships and market yourself. I think another thing that people do, that puts them in a bad place, is paying someone else to do it. Hey, Reed. All my people I haven't seen in a while. Thank you so much for that, heart me. So another thing is, people open and someone will tell you, just pay me or pay this person or that place, and they send you numbers of people. Thank you, purpose. I appreciate numbers, and they tell you call them. First of all, you could have just gone out and looked for numbers. Hey, Sparkle, thank you for joining. You could have just looked for that number by yourself and called. It doesn't work that way. There is more to that. Long time, Dr.B, missing. I'm missing you too, Mina. Good to see you. Good to see you. So, I hope you're hearing me, Mimi. If you want to, go ahead and subscribe to the TikTok Success Club. Join it. Gather as much information as you can. Get yourself ready. Oh my goodness, thank you. Purpose of Life says, did you see my comment? No, let me go back. See, this thing, comments flash by so quickly. I'm going to bring you up. Okay, Purpose says, I've had my one-on-one with you. I just need to continue with you. I switched from Oklahoma to New Mexico. That's okay. I would love to know why you switched from Oklahoma, though. Are you moving? Oh, Ray, thank you. Let me know. Okay. Oh, Mina, I see that, my refresh. Thank you for leveling up in here. So I just saw your comment. Yeah, so you switch. Let me know why I switched, because it was less complicated. Okay. All right, not a problem. Less complicated is always good. So let me pull up something on New Mexico. Are you going to move over there, or are you going to be doing that? Says they were giving me a hard time about my home care license in Oklahoma. Jamil says is the agency in the Bronx. Jamil, are you talking to? I am in the state of Georgia. I am not in New York. However, I was just talking about one of my clients who lives in New York, and she wanted to open a non-medical home care agency in New York. So usually, as I'm doing certain things, I like he says, "Oh, okay, sorry. No problem. I am in Georgia, but I'm helping people all over the states, in the country." So the clients in New York, we were getting ready, just putting her documents together, because prior to, now there was so much confusion in the state. So I called them and I said, well, do non-medical home care agency need to have a certificate of need? And when I left, before I left for my mission trip, I spoke with someone else. And if you know, when you call government office and some people will give you different information, she was like, no, you don't need it. You still can submit without it. And I decided, no, I'm going to call again. So when I called today, what I gathered was, even if with the certificate of need, there is no guarantee that they will approve. And remember, the certificate of need, you are paying $2,000 to apply for that certificate of need. And then you have to show proof of, thank you for the follow, you have to show proof of having enough finances to operate the agency for 2 months. Now, they don't tell you how much they are thinking of, right? So the only way, there are 3 criteria to where you're going to get that license after you've paid all this money, you've done all these, it's a lot of paperwork. You have to either be affiliated with an assisted living facility or be taking over change of ownership of an existing agency with at least 25 clients. MFM, I thought you were already. How can I subscribe for someone else? Oh, okay. To subscribe for someone else, you would have to go to where it says service right there. When you click service, go to subscription. When you go to subscription, you will see where it says send subscription to others. Scroll down a little bit, you'll see where it says send subscription to others. You click on that and you choose that person has to be associated with you, meaning they have to be either your friend or a follower here, and then you can send them the subscription. I hope that helps. All right. Hey, Yafir. Thank you for joining. So I found out that we were going to pay $2,000, and it was very unlikely that my client was going to get approved because of the memorandum that they've placed on it, and it will not be lifted until 2029 in New York. Yes, Lily, it depends on the state that you're in. As a nurse, you can start, even without being a nurse, you can start your home care agency anywhere. If you have a compact license, as long as that state where you are starting is part of that, covers that license, you're fine. What they're really looking for, some states doesn't even require you to be an RN or have an RN on your license. For example, the state of Massachusetts, which we are switching my client to, because New York, just like who said that? Purpose said I switched from another state to New Mexico because it was too complicated. So New York has made it a little bit too complicated without guarantee that you will pay all that money and get approval. So she opted to move her application, and she was already thinking about Massachusetts. Now, the thing about Massachusetts, it doesn't require you to have a license, right? Many of these states will say you don't have to go through a formal licensing process to open a home care agency. But the caveat or the catch there is, thank you so much. I appreciate it, Lily. Lily, you gave me a rose, and I want to say Lily and Lily. Ooh, thank you. Okay. Yes. Purpose of Life says New Mexico doesn't require license but need an SOP. Yes. So he's kind of, she's taking over what I'm trying to say. What I'm saying is some states may say we don't require you to get a license to open your agency. However, the minute you want to become a Medicaid waiver provider. Now, I say thank you for the you so much. Thank you, Howardens. Thank you for the subscription. All of you sending to everybody. Thank you for sharing. Thank you for doing that, MFM accessories. Can you imagine? I don't. Thank you. Thank you so much for doing that. So once you decide that you are going to become a Medicaid waiver provider, these states that do not require you to have a license to open the agency will now require. Oh, thank you, and your name, the way it shows. Thank you for grabbing that heart me. So they will now. Lee Pat says no sound. Can y'all hear me? If you can hear me, she said, thank you, thank you. Thank Nurse Excel. You can hear me. Okay. I don't know what happened there. She said, someone said they couldn't hear me. Okay. So what I was saying, yes, now it's going. Okay, okay. Dr. B, Lily said, how do I contact you? Lily, right here. You see where MFM was subscribing, where it says service? You would subscribe, okay. And then you would go to my profile page. There is a Calendly link for you to click and schedule a one-on-one appointment with me. So click that link and you'll be able to schedule the appointment. Hi, Mommy KK. Thank you for joining. So what I'm doing for my clients in the state that says no license is required, we are choosing one waiver program and we're applying for that waiver because you're going to, aside from taking private clients, you also want to be able to accept Medicaid clients. You want to grow your portfolio. You want to have more clients and not just focus on one revenue source, right? And oftentimes Medicaid has, a lot of clients on the waiver programs, but you have to choose a waiver that aligns with what you are doing, right? Each state, I did a live stream about the different waiver programs in different states a while back. So each state, I'm pinning a goal up there if any of you feel like it. If you don't feel like it, that's fine. But each state has its own, refresh. Thank each state has its different, like multiple waivers. So you have to choose. Like they have the waivers for traumatic brain injury, they have the waivers for children, they have, like autism and things like that. So whatever you want to do, you would choose that waiver. What states is that, ma'am? Spring Pro, it depends on which state you are. I'm talking in general about different states. Massachusetts, for instance, does not require you to have a license to open a non-medical home care agency. So a lot of people don't know the difference between a non-medical home care agency and a home health agency. Oftentimes people would just say, I have a home health agency. And I would be like, no, you don't. You have a... But each state sort of operates that differently. So just to put things in perspective, a home health agency is skilled, meaning you provide physical therapy, occupational therapy, skilled nursing, and then you still provide services like personal care assistant, homemaker, and all that. So you're doing all of these things, and you are then credentialed to be a Medicare provider, and you can also do Medicaid, right? We got that so far. And then the non-medical Abby Official says, what about Connecticut? I'm a check. I think, thank you for that, heart me. I think Connecticut requires you to have a license, but their process is different. Let me pull Connecticut. Let me pull Connecticut. I'm trying to stay on my thoughts so that I don't miss. And if I don't see your question, do you coach on medical? I coach on non. I'm opening non-medical for people, but I coach people who have both medical and non-medical. Because to be honest with you, aside from the therapies, you're doing the same thing. Yes, MFM. I saw that you subscribe for other people. I saw that it's under other people. I saw it. Thank you. That's why I was saying thank you. You did that for so many people. Thank you for that. Sierra says, Sierra, I'm pitching my tent here. You're so helpful. Ow. That is, I share because I have, we'll talk about that. One day, my people in this room made me cry. And my assistant said, you need to stop. You don't need to cry so much. So I'm not trying to cry. And, you can't please everybody at all times, but I try to give you the right information because I remember what it was like when I started a decade ago. Some of the people in our Success Club, they've come all the way to see me in Georgia. I've had people come from, from Florida to come see me. Oh my goodness. That is so sweet. Thank you so much. I appreciate that. Thank you. And so once you get started and you're good afternoon, Inspire. You get started and you have someone to kind of hold your hands and push you and encourage you, because sometimes that is all it takes. You will succeed. Frustration comes when you have no one. That's why the Deluxe Success Club that I have, it's a lot of businesses together and we share. For instance, today, one of our members, she had her license for 2 years, never had a client, didn't know what to do. And so when she came to me, we started with the community event. Today was her very first ever. We had to put all the marketing materials together. And so she went out and she looked awesome on her first marketing event where she's sponsoring an event, which is one of the things you do to gain clients. And so we put that in the group. It encouraged so many other people who are kind of like scared, like, what should I do? Where should I go? How should I make this happen? Dr.B, Medicare, we pay $700 and Medicaid is free, right? You mean for what? I'm not sure. Purpose of life, you mean for applying to become a provider? Have caregivers working on them and we go to different homes. Is that yes, that's a non-medical home care agency, Dreams Full 30. If you have, depending on which state you are, if you've gotten a license for that state. I want to answer about Connecticut. In Connecticut, you do not need a license, right? But again, if you decide to become a waiver provider for Medicaid, you're going to need to do some work. So you're going to need to apply. You're going to be required to have a nurse. All those things that they tell you don't need. Now, if your intent is to just open the agency and be private, just bill private pays. I know someone who that's all she does. And we had a business with her before the pandemic in New York. Things have changed in the state of New York since then. But she was only doing private payers. And she did not have any goal of expanding her agency. She had about 10 clients that were yielding her $50,000 a month. That was sufficient for her. And my job when I had her as a client was just helping her put the agency together, because it was one thing to get all people were coming. She had her 10 clients, but she didn't know how to put the documents together and make it an actual business. And that's what you want to do, because if you get surveyed and you don't have the documents together, you could very well lose the business that you're, grabbing money and running left, right, and center. So it is important. Thank you for tapping and for sharing the live. I appreciate you guys. So I want to understand purpose of life. You said, Dr. B, Medicare we pay 700. Medicaid is free. Ask me that again, or let me bring you up so that you can ask that question. Thank you, Rave. Let me bring you up so that you can ask me that question again. So I know that I'm answering it the right way. Because I'm not sure. I don't want to say yes and then I lied. Say you.
Hello, everybody. So, Dr. B, yes, I'm saying so for Medicare, right? Do we pay $700 for the waiver and then Medicaid is free?
It depends on the state.
Huh?
It depends on your state.
New Mexico.
New Mexico. Let me look. Let me look. Let me pull it. Let me pull it. Let me pull it. See why I didn't want to say yes or no, because it's about the same price in Georgia, but let me make sure.
Okay. And then like I said, I had my 101 with you, but remember, I had an orange logo at the time. I revamped. So I was doing Oklahoma, but they was giving me a hard time about my home care administrative license. And then Texas, they they were a little higher. Their fee is like 26.35 or something like that, and it was a process with them too. So I just chose New Mexico.
Okay. So in New Mexico, you do pay for Medicaid enrollment. And for Medicaid, it is the same as Medicare. It's $730. And I think that that revalidation is the same in all of the states now. Before it used to be free, because this year, as I'm doing revalidation for a lot of my clients, even for my agency, for each of my waiver, it is $709 in the state. Thank you for the follow.
Is
So
that per waiver?
so for a non-medical home care agency, right? You cannot take straight Medicaid. I hope everyone hears that. For every state in the union, you cannot be a straight Medicaid provider. You will be going in through a waiver program. Hi, Alexander. I'm doing well. How are you? So, for every state that you want to provide services and you want to become a provider for Medicaid, you cannot be on Medicaid directly. You're going to have to choose one of the waiver programs in that state, and then you will then be you will apply to become a provider for that waiver program.
Okay. I need to whenever you're doing a private class, I need to join. So I can go ahead and just get that out the way.
So we are going to, I'm gonna let you know. Do me a favor, send a message to our email and just say that you need information on applying to be a Medicaid waiver provider in
Okay.
the state. And what
Okay.
I do is give you the different, let me see how I can do that for, hmm, for the subscribers.
I can't hear you. I'm not sure if it's because the lady above me, because her microphone is on, but I can't hear you.
Let me mute her for a second. One second. Dreams of Hope. I muted you for a second. For I think I'm gonna find a way to give out the list of the different waivers. I did that before. But for all the subscribers, if you're a subscriber, I'm gonna send out a list. I'm gonna figure out so that you can see. If you send me an email, we will send you the list of the different waivers that's available in your state. You take time and you look through those waiver program and you see which one aligns with what you need, what your niche is for your agency, and then we'll go from there. Does that help you?
Yes, ma'am. Thank you so much.
All right, thank you. And Dreams Full 30, go ahead and ask me your question. Uh, I think you're muted. Let me unmute you. You're still muted. Can you unmute yourself?
Yes, ma'am.
Go ahead.
Okay, I have a question. I have some caregivers working up under me,
Yes, ma'am.
but the only thing they told me that I needed was just regular license.
What do you mean by regular license? And what state?
South Carolina.
Okay, 1 second. What kind of services do you provide?
Um, like I do bathing, washing, laundry. You know the works.
Personal care and homemaker service, companion. Um, you do need a license. So what kind of regular license did you get?
Ma'am.
What kind of regular license did you get?
Um, they're they're the kind that you can only get like for the city of Aiken, where I'm at, for
Okay,
just that city.
okay. So I'm congratulations on doing that, first of all. That tells me that you businesswoman, business minded. But the other thing that I want to break down is that if they get a hold of the fact that you're operating an agency, you will be fined because you're supposed to apply and pay. It's $1,000 for the state of South Carolina. You said South Carolina, right?
Yes,
For
ma'am.
medical home care agency. It is regulated in South Carolina. Like North Carolina, we have someone we're submitting now for North Carolina. And like North Carolina, South Carolina is a regulated state, meaning that you do need to go through the process of application. You do need to pay the $1,000 fee that they need you to pay, and you need to be renewing it every year. And that fee is $800. So if I were to advise, I would say maybe hold up and just be like you are just an independent person working on your own until you get all your documents together because you are operating as a and you should have a license.
I didn't hear that last part.
You are operating as an agency, you should have a license. You need to go through the correct process and get a license.
Okay.
So if you need help with that, that's part of what we do is help people open their agencies. You can subscribe to join our TikTok Success Club here. That's a way for you to, get the learning and the trainings that I do. But there is a link on my profile that you can schedule an appointment and you can talk some more and then figure out how to get your license so that you are not being fined because you're, you're, you're supposed to operate in. And part of it, you're supposed to, have drugs like there's a lot of to bring your agency up to par.
Okay.
Okay, I'm sorry. Did I did I make it sound bad? It's not that bad, but you do need a life.
Okay.
Thank you.
Thank you.
Welcome. And I think Yasmin asked me a question and said, "Is that for Pecos for Texas?" Yes, that's with the process for which you apply for that. I think you've already applied for a waiver program, Yasmin. I think so, if I'm not mistaken, from what you had said to me. So that's one thing that I want to really explain to people. You purpose of life say you can't hear me. Can you hear me? Can everybody hear me now? Went into tulip, haven't done picos. Okay. You started tulip. Okay. Purpose of life. Yes, now I don't know what's happening. Okay, yes, I can. Okay, okay, thank you. I just saw that someone said they couldn't hear me. I'm wondering if it's the cold. I'm trying not to go woo woo in front of all of you guys. And Papa says it was the one who said she couldn't hear me, but can when she's on mute, you can't. Okay, 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 okay. All right. So now you can. All right. So let's get back to trying to answer everybody's question. Nurse Excel said it was low before, it's good now. Okay. You do need to get a license in those states that say you do not. If you guys remember, we did a live stream a few months ago about the states that we call golden states, meaning you did not need to get a license in order to operate a non-medical home care agency. The issue with those are that when you are ready to become a Medicaid provider, you are going to be required to go back, do a criminal background check, because now you are about to do business with the government. So you need to get the background check done. You need to get your policy and procedure manuals and all of that. And I encourage everyone, whether you are in a state where you are being told that you don't need a license. Make sure that you have all the things. Thank you for the follow. That you have all the things that is required to operate as a business. Yes, you do need to get policy and procedures done. You do need to make sure that your employees are background checked. Even if the state does not provide the system for you to do so, like most states do, like Georgia, we have the G check system. It's imperative that the owner and all the employees be checked. The owner has to be fingerprinted even before you open. Most other state requires the same. And those that do not have it, you need to find another way to make sure you do background checks, because you want to make sure your agency is doing things right, and that the people you're sending, thank you for the follow, that you're sending into people's homes are people that you can trust. Because let's assume something happens. Yes, purpose of life, you're ready to go. If you have your policy and procedure, you've gotten all the documents that you need to hire and to fire. I always tell people, yes, there's going to be a fire someday, and you have all the documents to admit your clients from admission to discharge. You need all of those documents. If you have them, you are ready to go. And then the next step will then be to make sure that the runnings of your business is done, the financial part, that you know how to set up your accounts, that you know how to go then and begin to market. Because if the foundation of your agency is not solid and you start going out to do marketing and God blesses you and opens that door, it's going to be overwhelming. You're going to make mistakes. People do sue agencies. Remember that it is a business. You can get in trouble. And make sure that documentation is done right. Let me tell you something about documentation. In healthcare, for those of you who are nurses, you understand if you did not document, it wasn't done. Hang on, let me turn on the fan. I feel that hot flash coming. That's my life. It comes in and my nose starts getting shiny. And then I'll be looking some kind of way. Purpose of Life said, my policy is 3 MILL to 6. What do you mean? Are you saying 3 million to $6 million in what kind of policy? Explain that to me, please, because you're making me sweat even more right now. What kind of policy manual do you have? Purpose of life, come back and tell me. I want to know. We all want to know that. Yasmin, I love the way you just laugh. I'm missing Pauline on
It's
here.
my professional and general liability insurance.
Oh, thank you. I was like, gosh, I hope she didn't pay. Thank you, Rave. I appreciate that. I'm like, I hope she didn't pay nobody that much money. She don't need.
No. And that's what I did that insurance under.
Okay. Yes, because when you want to go to, if you want to do Medicaid always want your liability insurance to be about $3 million aggregate and 1 million for each occurrence. So if you have 3 to 6 million, you girl, that's more than enough.
Yes, I had seen that on there, but I was like, I'm gonna just go a little bit higher because you never know what extra could become. So I just wanted rather be, safe than sorry.
That helps too if you want to do a contract, because when you want to do contract with your like your county, that's another thing people don't know. There are contracts to be had for non-medical home care agency for your county, for your state, for your city. Sometimes they require like an umbrella insurance and all of those things. So if you have a little bit more in coverage, they might say, okay, that's that's good. So, but we digress. There's so much to dig deep into owning a home care agency, and I don't want to go into the contract thing yet. But yes, that's good. So if you have your liability insurance, you have your policy and procedure manuals, you have documents to hire and fire, and in between to do the assessment. Hey, Rev, thank you for, and you have all the documents to, your applications, all of those things, your agreement, you must have a service agreement for your clients. Because if you don't have a service agreement and someone gets to the point where, and this has happened, all of it, it's happened to us, where you're providing the service in the beginning, you provide the service, you bill them, and then they say, oh, I'm not paying for that. That's not what I agreed on. Not that we didn't have a service agreement. Thank God we did. Because if we didn't, it would be an argument and it would be all kinds of things. So make sure that you have a good service agreement that specifically states what services that you're providing, how much the services cost, and the uh the frequency of the service. Like, are you doing 3 to 4 times a week? Are you doing 6 to 8 hours a day? Those elements need to be included in your service agreement to keep you from getting in trouble with someone. Also, I did mention about lawsuits do happen, and yes, it happens. One of the things that can happen, family members fight within themselves. If you are taking care of their children or their parents, stuff happens that doesn't even concern you. Yeah, Mimi, you came in and I didn't see you until this moment. Good to see you. I decided to do a pop-up because something happened while I was getting ready to submit a client. So I figure let me come up here and talk about it and give people some information. Nini says you print out all the paperwork for your clients and employees, or is everything electronic? We give you electronically because that's the best way. There are some people that we give some paper stuff to, but I think electronic is the best way for you because you can make changes when policy changes. You can have it and you can customize it for yourself, as in putting your logo. When we do the policy and procedure, we try to customize it for our clients. Let me finish my thought on the lawsuit. Families fight. And then they will subpoena you. We discharge. Let me give you an example. We had a child that we discharged 3 years ago. 2 months ago, we got subpoenaed by the court to produce all the documents that we had on that child. Now we keep documents for 5 years, and you should. That's what is required. So your policy and procedure should talk about how you are going to preserve people's documents, right? And all of our nursing notes, all our caregiver notes, every documentation, it was this big. We had to send it to the lawyers. So you can be called upon. We've been called upon several times to testify in the court of law because families fight or they sue the hospital and they pull us in. So you want to make sure that your documents are intact, okay? So, Nini, it's best to give electronically. Besides, everyone that we do business with is not in the state of Georgia. Most of our people in the state of Georgia, we give paper documents, but those that are not in here, in Georgia, we have to send you electronic documents. Inspire said, you have a YouTube channel? Absolutely. Go to my profile page and you'll see it. If you click that link, it takes you to my YouTube channel. I think something is trying to come up.
Also,
It,
too, Dr. B,
yeah.
I'm not sure if you know or not, but there's another lady that's out of New York. She has a home care business too. And I know that everybody is not, tech savvy. Um, but if you go to Etsy, there's her name is Wise Care Caregiving, non-medical home care. She's on there and she sell those documents, and they come in bundles from intake to HR to um, every single piece of document from training your staff to service agreements. That's exactly how you just announced it. She sell it just like that for like 40-50 bucks. So if you're not tech savvy, you can always purchase it as well.
And I give all of those to our clients as well. I give all those documents to everyone that come to us. And our Success Club members, I review their documents and give them the things that they need if they don't have those things. But yeah, there's actually a lot of people that are selling, but when you buy them too, you want to make sure that you customize it to meet the requirements of your individual state, because some things are different. Yasmin says, purchase how? She's talking about, if you, Yasmin, if you don't have the documents, if you don't have like policy and procedure, or you don't have, the documents to admit the service agreement, all of those things you can purchase from someone. And we do sell that to a lot of our clients. We have people that just maybe they open and they want policy and procedures. We sell those as well, but we also, and we customize ours for whoever we're doing it for. Family home care. Okay, thanks, I didn't know that. Okay, thank you, Purpose, for sharing that as well. um Thank you for the follow. So I'm saying make sure that your documentation is good, so that when they pull you, if they call you, we all pray that then, oh my God, they're not going to call me. You never know. One day, boom, they call you. Do you offer a class? Yes, we offer a master class, and the next one is coming up in September. I haven't announced it yet, but I will. I also come on here and I teach. I usually do Fridays and Saturday mornings at 10 a.m. Eastern Standard Time, but I have been away for a while, so I'm just like coming back. This Saturday, I think I have a class registered to teach at 10 a.m. I'm going to be on here. And I usually tell my subscribers, if there's something, we have the sub only. If you are part of the TikTok subscribers, we have a sub only class where I really just focus on the things that are important to the subscribers. And that's always every Sunday evening. Unless something happens, then I'll announce that I'm not able to do that. But we do a sub only on Sunday evening. I believe it's usually around 7 or 8 o'clock. All right. I hope that helps. Thank you, Purpose, for picking those, giving those love stickers. I appreciate. I came on here at 5 o'clock. Family Home Care, thank you for joining. If anybody has any question, I want to summarize one thing. If you live in the state of New York, they are likely not going to approve your application in this moment, because you have to really show that there is a need. You have to pay $2,000 for that certificate of need without a guarantee. Oh my, you so much. I appreciate the roses. I appreciate the popular gifts. I appreciate all of it. Thank you. God bless you. And so you want to reconsider. Unless you are being attached to an assisted living facility, or you are buying an existing agency that has at least 25 clients and you're doing a change of ownership, that's different. But if you're coming in as a new non-medical home care agency in the state of New York, you have to go through that certificate of need. Thank you. Thank you. So think about that, okay? I'm gonna be on here, I believe, on Saturday or Friday, I think. See? I'm gonna be on here teaching again. If you guys have any questions, and you're a subscriber, send me the information that you would like for us to discuss when I come up here on, I believe it's Friday. Check my profile page. I have okay, it's August 1st at 10 a.m. I have a live event on August 1st at 10 a.m. You can just go and register for it. It's free so that you don't miss it. I see some people have already registered. It's going to be at 10 a.m. and it's going to be a Q&A session, and it's going to be for people who are learning how to start their businesses. Thank you. Thank you, Nurse Excel, for people who want to start their home care agency, for people who already have a license or have started and they are just not sure how to move ahead. Okay, we're going to talk about all of that. Yasmin, say yeah. Yasmin, I'm so happy to have you as part of the TikTok subscribers now. I feel so bad and scared. Oh, Dreams Full 30, don't feel bad. Go schedule a one-on-one with me, okay? Go and do it. We do charge $50. I think it's $50 for the one-on-one, but it goes towards any service that you would want with us. We can help you. I will make sure that you get all your stuff together. Don't be scared. Sometimes we just don't know. Yeah, Purpose of Life said she missed the previous one. Yes, and I will announce the next master class. So one of the things that happen is that people give so many conflicting information. If you don't know, you don't know. But the problem is that when the state does come for someone, they don't want to know whether you got the right information or not. But it's good to know. I always borrow the words of Dr. Maya Angelou. She says, now that you know, do better, right? You didn't know. I'm just paraphrasing it for those who want to come for me. When you know better, do better. That's about what it says. So now you know, and you have a process, and we can guide you through that process. Don't be scared, okay? There are some things you could do in the meantime. If you buy if you in the state of New York, Nini, if you buy an existing agency with 25 clients, they say that you will not, then you will have fulfilled the certificate of need, because it will show that there is a need. You get the logic? Because there's already 25 clients. Hey, Jesus. Good to see you. She said, "What word, First Lady? My favorite African." It's good to see you. Yes. So, what do I need to do to talk to you? Schedule the appointment. Go to my profile page, Dreams Full 30. You'll see that Calendly. Click it. Schedule that appointment. Okay. Let's talk one-on-one. Let's put a strategy together to help you. I would hate for you to lose the clients you have. There is a way you can go around it until you get your license. Okay? So go do that. Schedule the appointment, okay? Jesus Millennia say, "Hey Mimi." All right. Yasmin tapped herself out and tapped herself back. Not for Georgia. No, Nini, are you in Georgia? Georgia does not require certificate of need for a private home care agency. Thank you. Thank you so much. I appreciate you're fine if you're in the state of Georgia. I'll close my eye and open it for you in 2 weeks. It's yes. If you Let me tell you something that'll help you, Nini. I'm in the state of Georgia. I have Yasmin say it was an accident. Yasmin, what was an accident? What did you do? Um, she Shanda says, where's the link for Friday? Oh, it's on my profile page. Let me show you here too. If you go up here where my name is, click on that. Once you click on that, you'll see where it says live event and it says August 1st. Click on it. It'll take you to where you can register for that. I'm trying to catch everybody's MFM, thank you for those roses. Hi, Dr. B. I'm in Colorado. Does it require certificate of need? What license do I need? I'll answer in a minute. Um, yes, I came home sick, Jesus Melanie. I've been trying to get over this. How to have the clients. That's something we teach, Agnes. If you want to be part of our deluxe team, a deluxe success club, that's what we teach. It is not number one. I can thank you for that, Rose, that resilient girl. Oh, I love that resilient girl. And getting a client, number one, I do not encourage people to sit in their office, pay someone and say, go market for me. It's a sure way to lose your money and not get clients. You got into this business to help the community and make money. Jesus Millionaire, thank you so much for the roses. You need to build relationships. How to get clients, we teach you the step by step. You have to build it. It doesn't happen in a day. If I came up here and I said to you, I'm going to tell you how to get a client tomorrow, don't listen to me. I lie. But if I tell you, I'm going to teach you the steps you need to take, you build it up, and then the clients start coming. Trust me, that's what I've done for over a decade. I was talking to someone, I did a one on one with someone today, and I told them how I came back to 7 clients waiting to be admitted. That's in 1 month. For me, that's a big deal to have 7 clients in 1 month. It's a big deal because when you calculate how much each of those clients, we have one child, 56 hours nursing. That is $97,000 a year for that one client, right? And we have 3 of such, and then we have others that do not have that many hours. So 7 clients for me in a month is wonderful to admit, because then you got to make sure you have enough people to provide those services, because if you get them and then you cannot provide the services, you're going to lose them. So when I take you through the steps, everyone that open a business, the non-medical home care, the first thing, or home health agencies, I need clients, I'm like, slow down. That is not the first thing. Let's look at your document. Let's look at, make sure that you have all your ducks in a row. Because if they are not in a row and the clients come, you don't even know how to admit them, you don't know how to keep them, you're going to lose. And once people tag you as that agency, you're going to work harder to get yourself out of that. We had someone come over here from another agency last month. And I always ask my people to ask, how did you hear about us? And, if you're switching an agency, what made you switch? So that we know not to make that mistake. And she said, they didn't have a care plan. I asked them for a care plan. They didn't have a care plan. Now, who writes a care plan? It's a nurse. You see why all the people that I coach, I keep telling them it would be wonderful to have a nurse on your team. Even if your state did not mandate for a nurse as you are opening, you need a nurse on your team, because the nurse will be able to go do the assessment. The nurse will be able to write a plan of care. Everyone is not the same. You want to be able to offer individualized care. That's part of what makes your agency stand out. Agnes said that is true. Okay. You say, I have the workers. It's not easy too. Yep. You got to know how to run and operate and work with all these people. Nini says on the home care side. Okay, let me finish. Hey, Purity, I was just asking about you today. I have not heard one word from Purity, and I feel like I may have left Purity hanging a little bit. And I don't see Purity in the deluxe group. You're not in there. Good to see you. I hope everything is okay and your business is going well. We need to catch up. So for the state of Georgia, Nini, you Open up, we call it a private home care agency. You're allowed to do nursing, personal care, which is, the PCS, and companion care. So it's almost like a full service home care agency, except that you don't do the PT and OT. I have not done PT and OT since I started my business. I don't want to do it. If my clients require PT, OT, I partner with someone else or I refer them to someone else and we collaborate in that way. I don't do PT, OT. And you can still make all of the money. Trust me, when I say all of the money, you can still make all of the money. Nursing is a lot on its own. Okay. Hi, Agnes.
Hello, how are you?
Hello. I'm great. How are you?
Good, good. I didn't press that phone by mistake.
You pressed it by mistake. Okay. It's all right. And I can drop you down.
Yeah, thank you.
No problem. Okay. Oh, I think that's what Yasmin was laughing. And she was like, that was by accident. Okay. Thank you for the follow. All right. So, Nini, you can open it in the state of Georgia, and we open it for you with our eyes closed. You do not need a certificate of need for that. Yasmin said, do we need CHAP also or only PICOS? What's the difference? Okay. CHAP is accreditation, right? It's optional. CHAP, what's the other one? See, my mind just went blank, Yasmin. CHAP is you saying, I am this much better, I have gotten this accreditation. If not, PICOS is enough. I do not have CHAP. I did not apply for it because it's so expensive. Over the years I could have, but I'm okay. We passed the state survey over here, so you don't need it. It's optional. Hello, that resilient girl.
Hi, Dr. B.
Hey, how are you?
I'm good. How are you? You're sick, huh?
You see that? I went to take care of people and I took a little bit of what I said. I did not take it. I just got a cold. It's gonna go away soon.
Uh, I hope you feel better soon.
You, thank you. You have a question?
Yes, ma'am, I do. So I live in Colorado. I have my brother and I have been putting our heads together, and we wanted to start this non-medical home care agency. However, we're stuck. Like there is so much information out there that it's overwhelming. And yeah, like I see that there's so many like certain certificates that are required, and I just wanted um, some guidance, I guess. And I recently found your page, so thank God for that. And I appreciate all the videos that you've been putting out there. But my question is, from my research, I have found out that Colorado is a regulated state. So that means that we need a license, correct?
Yes.
Okay.
Yes, I think. And for I'm looking at Colorado right now. So for the state of Colorado, there's two kinds, right? You have what they call Class B and Class A. You would be Class B is the non-medical home care agency.
Yes.
Application that you're gonna have to go through. And the state charges 2,376 for the initial application. The state of Colorado. You require everything that most regulated states do. And that is background check, all the same procedure, all of these things that you have to put together,
Mhm.
block, structure, all of those things in order for you to open the agency.
I'm so sorry, Dr. B. Your voice was kind of cutting in and out. I could barely hear you. Could you repeat that for me, please?
What is happening to my phone? Maybe where I'm putting the phone.
Yes, that's better. I feel like when
That's what. Ooh,
yeah.
I will have to hold it. Let me show you what I'm using because I never do a live in my office, so I put it in here, and I think that it sinks it in and it doesn't allow people to hear me. Um, Let's see. Somebody came in and said, "Big auntie." That's funny. Yasmin. Okay. So I was saying in Colorado, I'm going to hold this for a minute. I was saying that in Colorado, you will qualify for the Class B, and you would need to do, their fees 2,376. You're
Yes.
going to need background checks, policy and procedure manuals. You're going to need a whole bunch of documents to put together in order to submit for the state of Colorado. But we can guide you through that if you want to.
Okay. Okay, perfect. So you
Um,
can help me out even though you live in Georgia?
oh yeah, many of our clients are in different states. We do all different states.
Okay.
So to start, I always like to have a first consultation with someone because there's so much more question I'd like to ask. And hi, Dr. Athene. Coming. So if you want, you can go to my profile page and schedule and click the Calendly to schedule a one-on-one. Okay. And
Okay.
then we'll go from there. Dreams Full 30s. Yes, I believe it's only PayPal that we set up for payment for our appointment. We set PayPal for a reason because number one, somebody broke into our account, so we can't do it any other way. PayPal sits like an intermediary for us. So thank you for that. Thank you. And Yasmin, yes, chap is $6,000. It is pricey, but that's why I'm saying Picos is 700 and something dollars. You are good with that. Thank you so much for saying that. Thank you. She said, Dr. B, so helpful. Thank you. You're welcome. Thank you. So, I used to do a free one-on-one appointment. Let me tell you guys about that. And I would get 30 people sign up for a day. And I would sit and not do the things I'm supposed to do because I want to make sure I honor the appointment. People will not show up. That's when I came on TikTok. So we went back but we gave our subscribers a discount because usually our actual consultation is $99, but we're offering $50. And that $50, if you decide to let us help you to pick on whatever service you pick on, whether it's a success club or opening your business, whatever, that $50 will go towards that. So that's how, because when people pay money for something, they respect it and they honor it. And I encourage everybody else to do that with their businesses because anything you do for free, people take you for granted, and then they get mad. I've had people get mad. Someone is saying PICOS is not the same as NPI. No, it's not. NPI is a number that you get as a provider of healthcare services. So you would go to the NPI site and you apply to get, and it's called the National Provider ID number. That's the number that you use when you want to file claims for your Medicaid services. Whenever you do business with the government, whether you're doing contract, oftentimes they will ask you for your NPI number. So as a provider of healthcare services, that's what NPI is. I hope that helps you.
Thank you, Dr. B. Thank you, Dr.
You,
B. I
you
appreciate
are
you.
so welcome. You're welcome. You're welcome. And I can drop you if you want me to drop you.
Okay, that's fine. Thank you.
You're welcome. All right. So I'm going to be going off now. Hi, Yadam. Seen you in a while. I haven't been on here in a while, but it is so good to see you. Yes, yes. Yasmin said you will need an NPI for PICOS. Yes, you will need an NPI for that. Hey, Ola, thanks for joining. I hope I answered everyone's question. If I didn't answer, hi, good to see you, Yadam. How's life treating you? If I didn't answer your question, you can come up and I'll answer it. Otherwise, I'm going to wrap it up and leave. My husband is in the next office. It's like everyone is gone. Why are we still here? When you're married to somebody like me, I keep the man from going home and eating dinner in time. Thank you guys for tapping. I'm going to need to know where to send it on PayPal. Oh, when you click the link, it'll show you. It says send. You use your credit card or whatever, and you just pay it. Just click that link. You'll see where it comes and it tells you to put your account information or something. That's how you pay for it. You don't have to go send it somewhere else. Just do it on that link. Shishanda is laughing. Yep. And he's such a good man, so he just let it be. I emailed you the names I chose. MFM. Okay. Maybe when did you email that? Maybe Grace got it. Okay. I'm looking at the email. Let me see if I can see it from my side. I think Grace got it. I'm gonna ask her tomorrow to tell me what you sent, MFM. Hey Benaya. Thank you for leveling up, Dr. Athenia. I saw that you leveled up in here. Thank you. I am going to, it says not approved. I don't know why it's not approved. This thing has its own mind. TikTok, I'm telling you. I'm gonna sign off, everyone. But if you go on here to my name, you click it, you'll see where it says live event. I'm coming on live on the 1st of August. Thank you, Yasmin. So just click, it's free. Just click and register for it so that it'll let you know when I'm coming on. And if you're a subscriber and there is something that is on your mind that you want us to talk about, we are going to have a subscribers only live on Sunday, as always. I think it's usually between 7 and 8 o'clock. I'm going to check again. My mind, since I've been away, it's like I've been away for 100 years and it's only been 2. So we're going to talk about that. And if you wanted the link, if you're a subscriber and you wanted the information about the waiver programs that's available in your state, I had compiled a whole booklet. I'm gonna see if I can just put it on my profile page. I don't know how to do that. I'm still trying to figure out a lot of. You are a subscriber to our TikTok Success Club, I will send you that link so that you see the different waivers that is available in your state. Because again, even if your state says that you don't need a license to operate a non-medical home care agency, you are going to need to do some applications, background checks, different steps. It looks like you're doing an application if you want to become a Medicaid provider. And listen, when I say that, you cannot be a straight Medicaid provider as a non-medical home care agency. You provide services through a waiver program. Okay, so we'll talk some more about that. Just register for the live and I'll see you guys later. Thank you for hanging with me. And if I didn't, Yasmin said, Dr. B, quick question. Is it true that the labor law posters are free? Some of it depends on where you go to get it, but I paid for mine. But you don't need to be paying for those people that everybody's gonna reach out to you to give them 300. If you don't have it, you're gonna get in trouble. I paid for that 15 years ago. I have not paid for another one. Remember, you are not a facility. People are not coming. Yes, people are not coming to sit in your office to, unless like now, and I have a lot of people in my office, then you can get the labor thingamajiggy poster. It is on, let me get you one of the links. Everybody's selling it, I'm telling you, but you can get it from your state, your federal and state labor poster. You can just go to your state labor office site and you can get it there for free. Otherwise, you have to buy it. There's a place called Labor Law Posters Online. You can buy it there. Hey, Jesus Millionaire. I love seeing all my people. So, Yasmin, I hope that helps. If not, I'm going to see how I can put it in the I think I'm a jiggy for you. I'm going to bring Jesus Millionaire up for a second. I'm getting ready to close shop for today so I can take my husband.
I have a quick
Do you know that I went to the bank today
Uh-huh.
to try to open that account, and then they say, "Oh, you don't have an authorized blah 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 on your ELC, on your on your on your LLC." I'm like, "What?" I'm like, "I'm the authorized." They're like, "Did you do it yourself?" I said, "Yes." And they're like, "Oh," so I had to make a call to the state, and then they're like, "Oh, you have to pay $25 to do an amendment. It's gonna take 8 weeks." Like, how the heck did I miss that part on there?
Did you miss?
Huh?
What did you miss? What didn't you put on the
They,
application?
they say, okay, so I was the registered agent. I'm the one that created it. But then there's another part that says authorized, blah, blah, blah.
There are
And
two.
I didn't see it.
Oh.
So now I have to print all this paper off, then I have to fill it out, and then I have to mail it with the money order.
They don't want you to do it
And
online.
then do it online. I don't think there's an option there to do it online.
Do it online. It's faster. When you do an
The
amendment on,
guy I talked to told me that I have to mail it in.
you can do it
I
online.
was so upset.
Take 8 weeks.
Yeah,
Actually,
that's a long time.
go back, log in online, and see where it
Yeah,
says,
there should be a section that says amendment.
yes, there is a section that says amendment. It's Florida, right?
Yeah.
So,
So now I have.
did you send it already? Did you mail it out already?
No, no, it was today that I found this out.
I don't know how you missed that.
It was an old guy, so maybe he doesn't remember that it's possible online.
You said what?
The guy I was talking to sounded like an old guy, so I'm like, maybe he doesn't remember I can do it online.
Talking about the
Oh Lord.
same part. So let me. I'm on here now. Let me say, um, find an amendment.
Yeah.
LLC. Articles of organization. Uh, it's on there. Go back on there and check.
Let me go in there right now.
You can amend your LLC. Just go because you can follow a good solution. You can do
So I'm gonna tell you where he's told me. He told me to go to forms and fees. Then I should go to limited liability company. Then I should go to where it says Florida LLC forms. That's what he's telling me. But where do you want me to go?
under Florida LLC forms. They give you the amendment documents. Yes.
But the thing is, it's just giving me the PDF. It says amendment PDF. Unless Florida is behind.
Unless Florida is there, because you can do all these other things online. It says yes, you can amend your existing license online. Okay, let me walk you through the steps.
Yeah, you should be able to do it. Then do the payment option at the same time.
I'm gonna pick this up and then I'm gonna flip it and then oh, they said yes, you can do it, but they say you must after you cannot send it through online. They say
So you can fill it out there, but you. Yeah, he tell me I could fill it out, but then I have to mail it.
old man is not so old. He's
Oh
fine.
my god. So that's costing me another 25. So pretty much it's like I paid 125, so it's like 150 now. I don't even know how I missed that part. We didn't go through step by step because remember you were busy, and I think I did it while you were gone.
Because I was in the mission field when you send me a message. It was
Yeah, yeah. Oh boy. So I didn't want to text all of that in the message. I said, let me just come up and let you know what's going on.
so it's okay then. You know how what we always say. You and I talk about it, and we say sometimes it may be God's way of delaying you for something. That's okay. I know.
Yeah, that is so hard sometimes to like accept, but I will accept it. I'm not the boss. He's the boss.
This is good.
Okay, my dear.
All right. Thank
All right.
you.
So you're here today, but when again? Well,
On
I'll just look for the notification.
August 1st. It's on there. I actually created the live event so that people can register for it. It's free. It's just,
You're coming in August 1st, you said?
10 a.m.
Okay. I'm sure I'll get a notification.
Yes. Amen.
I don't even know if my. Can you check the subscription? If I need to. Do you know how to check? If you could check mine? Because I don't even know how to check it to see if it's there. I think it should be up now, though. I think I'm here a month already.
Well, they would have told me that you are under at risk of losing because
Oh,
that's
okay.
what
So it
it
didn't
says.
say. Unless. You know what? I saw TikTok take out some money out of my account. I was like, what did they take? Why did they go in my account?
That's
So
right.
maybe they took it. Maybe they took it. Yeah, I think they probably did. I just, it was like for almost $5 or something.
Maybe that's it.
Maybe they think, oh, this is your friend, Dr.B. You should just go ahead and pay. They just, oh, that's your good friend.
Yeah, I get emails. I mean, I get a message from TikTok for the many people. I subscribe into many people's thing just to support people. So when it's time to renew, they tell me it's gonna expire. They renew again. So they
Okay,
should.
well, I'm
Okay.
getting a phone call, so
All
take
right.
care. Okay, we'll talk soon.
Thank you. The live is at 10 a.m. on Friday. Thank you, Mimi. Nurse Excel says, even in New York, you have to send in money order and it's 60. Wow, for an amendment. So you got to be very careful. Pay attention when you're filling those things out. And Yasmin say you got to go to the court to register in in uh in Texas. Wow. Georgia, Georgia is so good. You just do all these things online. Yedem says it's a website a must when you start Dr. B. Yedem, it is not, and Yedem, it says you're going to lose your subscription. It is not a must, but it's needed. See, the way that I look at the website is how you open the door to your business, right? People are online a lot looking for services. If you don't have a website, what's going to happen is the people who are looking for services online will not find you. Social media presence, website, people go through search engine optimization. You want to cover all the angles that you can cover in order for you to get clients. Okay, so I built the first one for my agency myself 10 years ago. I did it by myself because I just didn't have the money to pay someone. And I thought it was a terrible, hi Kami, good to see you. I thought it was a terrible website. But when we did our major marketing event in 2017, and the people looked at it and they were like, who built it? I said, I did. And they're like, it was good. So, hey, I'm back. Yes, I am Kami. Good to see you. And I'm about to get off now. Thank you guys for tapping me to 54,000. I can't believe we did that. Thanks, Mimi. Thanks, Kami. Thanks, Nash Braids. You just got in here. Good to see you. I will be back Friday at 10 a.m. Nurse Excel, thank you. I think you tapped yourself out, tapped yourself back in. Thank you. you so much for hanging with me. If you have questions, we're going to be here doing a Q&A session on Friday at 10 a.m. So bring your question, write it down. I'm going to come prepared. You guys know I come prepared. Thank you for the gift. Thank you for the heart me's. Thank you for the tapping. Thank you for the question, the engagement. Oh, Annie, good. Thank you for the roses. I'll see you guys on Friday, okay? Have a good night. Let me go blow this nose so I don't do it in front of you.